Urban listeners, it's time to continue watching 90 Day Fiancé. My name is Dr. Kirk Honda. I'm a therapist and a professor. As I always say, don't use YouTube as a replacement for therapy. If you need a therapist, get one. You deserve it. You really do. Let's watch.
Right now, it feels just pretty clear to me that Natalie doesn't give a shit whether I'm here or not. So, I mean, why would I stay, I feel like? I got the keys to the truck, so she wants to leave me in the dark. She can figure out on her own. Screw it.
Wait, what? So, am I missing something? So, they were, they live in Sequim, which is a few hours away from Seattle. And they came to Seattle to stay in a hotel room so she could wake up in a reasonable hour and get to the surgery instead of waking up in Sequim and coming all the way over to Seattle. And he wakes up in the morning and she's gone or something, or she left the other night or something. He's looking around for her. He finds the truck at the hospital. It looked like the producer of the show drove him out there. Not sure. And he's hurt, which is understandable. He's not expressing that he's hurt. He's expressing that he's frustrated and bothered, feels disrespected. But at the core of that is pain, is a feeling of rejection, I'm guessing. And then he sees his truck. He knows that she's in the hospital having pretty involved surgery. I mean, in surgery on your, whatever you call this area, your breathing passageway has got to be involved. But regardless, he is now getting in their shared vehicle and driving off. So on one hand, she did that to him. She took the car and drove off. So he could say, well, she drove off with my car. I'm going to drive off with my car too. But under the circumstances, what are you doing? She's in the so what do you expect is going to happen, pal? She's going to come out of the hospital, probably very bandaged up, maybe drugged up, and looking for her truck. She can't find it. What is she supposed to do? I mean, hopefully you called her at the very least, left a message saying I took the car. But why would you do this? I mean, it's so much hostility, so much mean behavior. I understand that he's hurt. I understand that the two of them are triggering each other a lot. I understand the two of them probably are building up a fair amount of contempt for each other. But I guess what we can learn from this scene is that when we're going through a breakup, we will do very different behavior than we would otherwise. If you've ever been through a breakup and you look objectively at your behavior, and along those lines, let's all self-disclose below. Tell me something messed up that you did. Hopefully you're nothing illegal, but something like this, where you look back and you're just like, oh, like I was in such a bad place. I had so much pain that I did X, Y, and Z. I slashed his tires, whatever it is. People do this. We can admit that. The other thing, just as a side note, was I didn't stop it, but they drove just a couple blocks away from my university when they were driving downtown, and I was like, yay, downtown Seattle on my TV show. And now the hospital, I think they're up on the Pine Lake Plateau. I'm not exactly sure. There's a new set where I grew up. I grew up on this plateau that's pretty far outside Seattle. I mean, not super far. It's like 15, 20 minutes away from Seattle. But so it's just always fun to see my hometown represented on this show.
Good luck getting back home to Sequim.
I mean, that is dark. That is dark. Good luck getting back home to Sequim. And again, we're talking about hours. And if they're on the Pine Lake Plateau, which I think they are, we're looking at 4 hours of a trip. Now, presumably she has Uber or something, and she can just charge it to his credit card, maybe, because she doesn't have money, right? Maybe she does have money. Either way, that's cold. That's pretty dark. You're not going to make a lot of friends in the audience doing something like that.
I definitely want her to come out of this. Yeah, that's the important thing right now. You know what I mean? But I need Natalie to communicate. Like, hey, I'm on my way to the hospital. Hey, this or that. Like anything's better than this right now.
Okay, so he went back. Thank goodness. All right, good. All right. Now, as I've been saying for a while now, the way he communicates his hurt is by saying you have to communicate. And the way she communicates her hurt is by not communicating. And the way he communicates his hurt is by not communicating. So they both purposely withhold communication to the other as a way of passively hurting the other person. They're trying desperately, I think, to communicate that they're hurt by ghosting the other person emotionally. And of course, that doesn't get across the other person. It just triggers the other person, and back and forth they go. I think Mike in particular does this. I think Natalie does it a little bit, but Mike in particular.
Okay, careful, okay? Slippery.
Wait, they have a dog? Is this the first time we've seen this dog? I know they had a dog. It's a cute dog.
And now she only wants my help when it's convenient for her. I just feel like I can't win with her. I'm trying, and I'm always 2 steps behind her.
Yeah, so I've seen this before. I don't know if Mike suffers from this, but there's a relational trauma condition of an adult where, and I think men might be particularly prone to this, where you feel as a man, but really anyone, let's just say anyone, that it's your job to take care of other people, and that other people need to be comfortable and safe and happy and fed and take, all those things. And when things aren't going well for the other person, you feel anxious because, one, you just feel anxious for your partner, but two, you also feel anxious that you're failing somehow because it's your responsibility to fix things. And so you will try to fix things, but for one reason or another, you can't fix things, or the other person that needs help doesn't really want your help, or something's happening. And then you, without really knowing what's happening inside of you, you get hurt and you feel rejected and you feel like a failure and you're scared that you're not useful and you're not aware of those feelings, and you transfer them to anger and hostility. And then you're like, how come, you're doing this to me? You're not communicating to me. How come you're always complaining? You're always, and it comes across that way to people. She just got out of surgery. It's a big deal. Their relationship isn't going very well. And, she's trying to ask for, I need some food. And because he can't fix the whole problem, I think maybe that's what's happening for him, is he's feeling like a failure, even though he's not in the situation, and then he gets angry and hostile towards her. All right, well, that does it for that episode. We are coming up on our 13th anniversary of the podcast, 13 years, and so we're going to have a 13-hour live stream on August 7th, 2021. If you want to send a card or a gift or something, you can send it to Psychology in Seattle at 10002, that's 3 zeros, 10002, Aurora, as in Aurora Borealis, Avenue North, Suite 36, number 214, Seattle, Washington, 98133-9334. And everyone out there, please take care of yourself, because you deserve it. You really, really do.